Hi all, my name is Maggie. I am an audiology extern, which means that I am in my 4th year of graduate school and I will be an audiologist when I graduate. An audiologist is someone who does the testing of the hearing and balance organs in your ear. So there are 3 parts to your ear. We have your ear and your ear canal, which is what most people think of when they think of your ear, but there's 2 other parts. There's the middle ear, which houses the 3 smallest bones in your body. Then there's your inner ear, which is actually what does your hearing and is responsible for your balance system. Both of those are connected to a nerve, which goes all the way up to your brain and tells your brain what you hear. An audiologist, like I said before, does the testing of your hearing and balance organs, which means we have to find different ways to test your hearing. I work with kids from being a newborn little baby infant all the way up until you're well over 100 years old and everybody in between. I love that I get to work with all different people, and there's a lot of different ways that I can test your hearing. For newborns, what I do is I stick teeny tiny stickers on their head, behind their ears, and I place little headphones in the baby's ears. I then play different sounds and measure what the brain is able to hear. Once kids get a little bit older, say around a toddler's age, around 2 years old, the test that I do is I put the baby on the mom and dad's lap and I play different sounds in my sound booth. My sound booth is soundproof, meaning that you can't hear sounds from outside of the room, you only hear the sounds in the room. With the baby on mom and dad's lap, I play sounds out of my 2 speakers. I train the kid so that when they hear the sound and they turn to look at it, there's a little toy or a fun screen for them to watch so that they're excited to turn to see whatever is playing. That way, I'm able to play all different kinds of sounds from low, bassy sounds all the way up to high-pitched, squeaky sounds and have them respond and see what they can hear and what they can't hear. Once kids get a little bit older and they can sit by themselves and wear some headphones, we train them how to play a different game. They put a toy up to their ear and they listen for the teeny tiny bird squeaky sounds. Once they hear that sound, they know to go ahead and place the toy into the bucket. Once kids get a little bit older, probably around your age, all the way up until they're adults, we have them listen to the sound. Once they hear that sound, they raise their hand, letting me know that they heard it. That's just one of the many different ways that I can test people's hearing. When it comes to testing people's balance, there's a whole bunch of different tests that we can run. Have you ever sat in a chair and you spun around and you spun around and you spun around and then you stood up and you felt like you were still spinning? That's your ear. Your ear is telling your brain, hey, we're still moving, hey, we're still moving. And it takes a couple seconds for your ears to realize, oh, we're not spinning anymore, and let your brain say, hey, we stopped spinning. Lots of different tests that we can do with people. We put goggles on people's eyes, we put more stickers and test the brain and test the ears to see how well their balance system is working. I work in a lot of different environments with a whole lot of different people. Like I said, I work with little babies all the way up to full-grown adults. I do a bunch of different things with all of my patients, but the best thing I get to do is help people hear, which means I fit people who have hearing loss with different types of hearing aids. So for kiddos, we get to pick out lots of different colors and ear molds, and we stick the hearing aid behind their ear and into their ear, and it helps them hear the sounds that they don't hear as well. Same thing with adults. We find lots of different hearing aids that work best for those people, and so that they can communicate with their family. For people whose hearing organ is broken or really does not work at all, we use something called a cochlear implant. In those situations, I work with an ear, nose, and throat doctor. Those doctors are also surgeons, and they perform a really small surgery, and they place what's called an electrode into their inner ear the piece that is connected to your hearing nerve. What it does is it basically acts as your new inner ear. So there are two pieces. There's that internal piece, which is the surgery, and those people work with the ear, nose, and throat doctor. Then they come and see me, their audiologist. I fit them with what is called the processor or their hearing aid. So they stick it on the outside of their ear and it works with that internal piece so that they can hear. It looks something like this. So this piece that's on the back of their head connects to that internal piece where they had the surgery, and this piece that sits behind their ear picks up all the different sounds so that they can hear. That's probably my favorite part of my job because these people had no way to hear before, and they can now hear really soft sounds and they can learn how to speak just like you and me. So like I said, I work with a whole bunch of different people, patients of all ages, and I also get to work with lots of different doctors and nurses and different medical assistants. I work in an audiology clinic. There are lots of different options that you can work as an audiologist. So you can also work in the NICU, which is the part of the hospital for sick babies. You can work in an operating room. You can work in a private practice, and you can work in just the hospital, helping people hear and trying to figure out what can they hear and what can they not hear. How do you become an audiologist? So it's a lot of schooling. So I am in my 8th year of school. So I did 4 years of college, and I learned a little bit about hearing and I learned a little bit about everything, but that got me ready to apply for what is called graduate school. So my graduate program is for the Doctorate of Audiology, which means that I have a special degree only in hearing and balance. So I had to apply to get into graduate school. I did some different interviews and I looked at multiple schools to figure out which would be the best fit for me. I then went to a university called Wayne State University in Detroit, Michigan. I studied for 3 years there, and I learned I took, all of my different classes for the hearing and the balance, and I also learned about how to work with different patients. In addition to my classes, I also started working in the clinic, meaning that I was hands-on learning how to do the different tests and how to talk to my patients and how to help them hear. My 4th year, which is what I'm currently doing, is my last year of school where I work Monday to Friday as an audiologist, but I work with people who are audiologists and we work together. They make sure that I'm doing everything correct and that if I have any questions, they're there to answer all of my questions. So after graduation, I am required to get what's called a license of audiology. Every different state has different rules and different licenses. So I'm from Michigan, so if I move back to Michigan, I have to get my Michigan audiology license, which is basically saying that I took all of my tests, I did all of my hours in the clinic, and I have graduated and I'm ready to see patients. Once I have that license and my degree, I am ready to see patients. So in just a few short weeks, I will have all of that done and I get to start seeing patients on my own. I love to do so many different things as an audiologist. I love to see patients who are kiddos. I love to see patients who are adults, but I really love to help them hear, whether that's with a hearing aid or a cochlear implant. It's very rewarding to help people hear. They're so grateful to be able to communicate with their family and to be able to hear really soft sounds like the birds chirping in the morning. My advice for someone who's interested in learning more about audiology is to go and shadow an audiologist. We love to have students come and see what we do. I'm sure you know somebody with a hearing aid or with a cochlear implant, and they work with an audiologist to get that. So if you know your grandparents or your parents or your sisters or your brothers or somebody with a cochlear implant or a hearing aid, ask them if you can go to one of their audiology appointments and see kind of how things work to learn more about it. Um, I also always recommend volunteering and finding different ways to get involved in your community. If you have an interest in something, go and learn more about it. Lots of people want to help you and they want you to succeed. It was so nice to meet all of you guys. I hope you've had a great career day. Thank you so much for having me. Have a good day.